Hi everyone, thank you for coming promptly to your surgery group discharge for your cats. In just a few minutes we're going to be handing out surgical discharge paperwork for each of you. The first 2 pages are all of the medical notes from your cat's visit today, including anything that the doctors found on the pre-surgical exam, any procedures performed today such as vaccines, flea application or prevention, microchipping, nail trimming, anything like that. We would ask you to pay special attention to the vaccines that were given. Next to each of them, it will indicate whether or not the cat should come back for a booster shot sometime in the next either month or 2 months or in the next year. So please take a look at that carefully. Also included in that medical record are any medications that were given today in-house and all of your post-op instructions. We're going to go through all of the post-op instructions with you in just a moment, but it is all written and you'll be taking it home to refer to later. Also in your packet, if your cat got a rabies vaccination today, will be a certificate of rabies vaccine and a new tag, as well as a certificate of spay or neuter. There'll also be a certificate of microchip. If you microchip the cat today, please remember that you do have to register all of your contact information with the microchip company. And if you should move or change your phone number anytime in the next 10 years of the life of the cat, you do have to make sure that you update the information with the microchip company. Otherwise, they will not be able to contact you should the pet get lost. In a nutshell, we do recommend that you try to keep your cat as quiet as possible for the next 10 to 14 days. That does not mean crate the cat indefinitely, but if they go through real high activity periods, try and keep them a little quieter. Also, take a look at their incision area twice daily for the next 2 weeks or so. Be watching for any signs of possible infection, such as pronounced bleeding, swelling, discharge, or opening up of the incision area. The female incision is right in the middle of the belly, and there'll be a very small green tattoo next to it, which just indicates permanently that that cat was already spayed. The males obviously have a very small surgical incision in the scrotal area. They do not receive tattoos, however. You'll want to try and keep your cat's incision area clean and dry for the next 2 weeks as well. It's very important also to keep them from licking at their incision. If they do lick, they're likely to open it up and get it all infected. So all of the cats are going home with the e-collar or cone. We do recommend that you keep this on the cat for up to 2 weeks, especially when you're not directly supervising them. All of the cones have already been pre-assembled, so you don't have to take them apart. Just slip it right down over the cat's head. Tighten up the gauze so it's tight enough so you can get 2 fingers in there, but they can't easily get the cone off or get a leg stuck up in there. When you get the cat home today, go ahead and offer fresh water right away. And once the cat is fully awake, a little bit of food. If the cat vomits, we do recommend you hold off either several hours and give them a small amount of food again, or it's okay to just make water available and hold off until tomorrow, the day after surgery, to start feeding them again. In addition to checking your cat's incision area twice daily, we also want you to be very aware of the cat's behavior over the next 2 weeks or so. Be watching for any signs that the cat is not feeling well, such as persistent vomiting and diarrhea, real depression or lethargy, or a loss of appetite. Any of these things can also give you the indication that the cat may be getting into an infection or some other problem. If you see any of these problems or any problems with their incision area, we recommend that you call us at RCAC right away. If we're available, we'll have you come in most likely and just take a look to make sure everything's okay with the cat. If we're not available and open, We do recommend that you call your own vet or any other full-service animal hospital you can find in the phone book. We've also listed the name and telephone number of the 24-hour, 7-day-a-week emergency center located in Henrietta. Please know, however, that that is a critical care center, and just to walk in the door, it's going to cost over $100. So we're definitely your best bet if you should have any concerns or questions. Thank you again for bringing your pet to RCAC for spay or neuter today. By choosing to spay or neuter your pet, not only have you helped our community to correct the overpopulation problem, but you've also taken an important step toward offering your pet a happier, healthier, longer life. Please take a good look over the discharge paperwork that we're sending you home with, and certainly if you have any questions or concerns, just see one of our client service reps or give us a call and let us know how we can help you.